News Radio 102.9 KARN, Dr. Steppe Mette. He's the CEO with UAMS. Dr. Mette, good morning.
Good morning, Kevin. Hope you're doing well.
Doing fine. I wanted to check on the rollout of the COVID-19 vaccine and what you're seeing. There's an article and a story here on our news partner, Channel 4, that talks about the rollout in a lot of places has been a little slow. Some of the vaccine for Arkansas is still sitting in storage. So what do we know about this?
Well, I think it has been, the rollout has been slower than we had hoped or anticipated, but it sounds like things are gearing up now with the opening up of health systems participating in the vaccination. Now the 1B group, beginning to vaccinate the public. So I think there has been some conservatism in how we roll things out because of uncertainty of supply. That's loosening up, and I think we're all pretty optimistic that we'll have a lot more citizens of Arkansas vaccinated shortly.
You know, it's a question that's come up over the last couple of days. Have we been caught up so much in the logistics of this thing that we've been doing that more than actually getting the vaccine out there?
I think there's been some concern about that because of the uncertainty of supply, to make sure that there was some withholding of the second dose, make sure that there was a second dose for those initially vaccinated. But with the different strategy now, assuming that we're going to have adequate supply from the manufacturers, that kind of conservative approach to withholding some supply is loosening up. So that might have been part of the problem.
Right.
I see that becomes less of one as we go forward.
What about the supply? How are things there, and when is more expected?
Well, the Department of Health is the controller of the supply, and they really are dependent on the manufacturers getting them the vaccine. With the HHS, Health and Human Services, allowing for and not holding back the national supply, that supply to the state should improve. I can tell you that at UAMS we have seen a pretty significant improvement in the allocation of vaccines that we're getting, allowing us to increase our vaccination rate.
Right. It's Dr. Steppe Mette with UMS. What is this going to look like when it really opens up a whole lot more? I mean, is it going to be us going to the pharmacy, or are there going to be places where we'll just do drive-through shots? What's the picture for this?
Yeah, I think there are going to be multiple different strategies, Kevin, all around the state, depending on where you live and who will be supplying the vaccine. Certainly with health systems starting to do this, there'll be an increased number of sites. Our own strategy will be working together with other hospitals and health systems in central Arkansas and around the state with the pharmacies. We will be vaccinating on campus as well as a mobile strategy.
Dr. Mette, what about any concerns I might have involving health? If I'm a lady and I'm pregnant, if I have underlying health conditions, are those issues with this vaccine?
As far as we know, no, not a negative issue. The more that you are at risk, the more important it is to get vaccinated for your own health. And although there are insufficient data to really know beyond a shadow of a doubt the safety in pregnancy, there are some data. There is some evidence to suggest that it is fine, safe, and the OBGYN societies promote and advocate for getting vaccinated, even if you're pregnant or breastfeeding. And that's the education that we're giving our patients as well.
Right. He's the CEO of UAMS. It's Dr. Steppe Mette. Dr. Mette, also, too, what are we looking at as far as the hospital situation in the state? We're seeing these cases continue to be on the rise. What are we looking at there?
Yeah, we have a pretty resilient health system in the state, Kevin, even though we continue to see hospitals full, nearly at capacity. All hospitals have what we call surge plans so that we can increase the capacity beyond our normal amount if needed. Here in central Arkansas, we've seen some stabilization of hospital rates over the last couple of weeks, which is always nice to see. We remain confident that the health system is here to take care of any patient that needs to be cared for.
Once I get the vaccine, do I need to continue to wear a mask? What's the scenario there with this?
Yeah, until the health emergency is over, until we have achieve that level of community immunity, meaning 85-90% of the community either having had COVID or been vaccinated. The public health community is still advocating for, and the CDC is still suggesting that we continue with the same strategy of masking, social distancing, and washing hands and avoiding big crowds.
There's a certain segment of the population that's adverse to taking the vaccine, and I'll get just blunt talk. I was nervous about it until I read more about the science, and then it made a whole lot more sense to me. What about that segment that does not want to take the vaccine? They want to wait until a little bit more down the road. Let's see what happens with that.
Yeah, certainly understandable, given the history and some distrust of science in the United States. I do think it's all of our responsibility to get educated and to educate others, to continue to show the evidence and show the science. And the more that people get vaccinated and see that there really is no negative effect and that this is really going to be beneficial for everybody, I think the more easily it will be to convince those that are hesitant.
Dr. Steppe Mette here on News Radio 102.9 KARN. Dr. Mette, I'd like for you to approach something. You hear this thing going around on social media. I think it's a myth, but I don't know where people are coming up with this. They're saying that hospitals are increasing the COVID cases or calling it COVID when it's not, because the hospitals make more money by calling something COVID. What's happening there? Is there any truth to that?
I don't see how that could possibly be truthful, Kevin. A diagnosis of COVID is based on a test that is objective, easy to see how the test got taken, what the results are, easy to query, they're accurate, so a diagnosis is certain.
Do the hospitals get a bonus if they diagnose COVID?
There's no bonus. There is, through the CARES Act monies, that hospitals that have had to take on additional costs because of the care of COVID patients, there have been some federal relief monies for that. And then the what we call a DRG, or the payment from Medicare, there is a additional amount that is considered for COVID care, because the cost of care for a patient with COVID who is hospitalized is higher than it would be for another diagnosis.
Not exactly profitable for a hospital diagnosing COVID patients.
I can tell you that it's not profitable.
Dr. Steppe Mette, CEO of UAMS, good to have you on this morning. Thanks so much.
Nice to talk to you. Bye.
All right. Much.
Nice to talk to you.